this week's episode of Health Watch, we tell you why cochlear implants are a remarkable solution to those who have severe to profound hearing loss. My name is Belden Waliaula, and we'll also show you how this surgery is done. Hearing loss, whether from birth or acquired later in life, is a challenging experience. While hearing aids offer a solution for some by amplifying sounds, they may not be a solution to those with congenital deafness. However, cochlear implant surgery is one of the few ways to enable one to decode sounds.
Cochlear implantation is really for children or adults who have got severe to profound hearing loss who cannot benefit from the conventional hearing aids. So the extent of the damage of hearing is such that they can only benefit from a cochlear implantation, and that is what we are providing for them.
And the majority of the people that require cochlear implants are children who are born without hearing, what we would call born deaf.
Various circumstances in life may lead one to experience hearing challenges.
You can get a sudden deafness either from maybe too much exposure to noise. A sudden deafness like a big blast can damage your ear profoundly, in which case you will require a cochlear implant, or it can be due to medication as well. Certain medications can affect hearing and cause complete loss of hearing, as well as also you can get an accident. And so in order to go back to your life the way whatever you are doing, you will need your hearing back again.
A cochlear implant is an electronic device that improves hearing. It can be an option for people who have severe hearing loss owing to inner ear damage. This makes it harder for one to lead normal life, even with conventional hearing aids. Normal hearing aids amplify sound. However, cochlear implant bypasses damaged portions of the ear to deliver sound signals to the hearing nerve. These implants use a sound processor that fits behind the ear. The processor captures sound signals and sends them to a receiver implanted under the skin right behind the ear. The receiver then will send the signals to electrodes implanted in the snail-shaped inner ear or the cochlea. The signals stimulate the auditory or the hearing nerve, which then directs the signals to the brain. The brain interprets those signals as sound, though these sounds won't be natural as we are used to. It takes time and training to learn to interpret the signals received from a cochlear implant. Within 3 to 6 months of use, most people with cochlear implants will have made considerable gains in decoding and understanding speech. But there's a difference between cochlear implants and the electronic hearing aids. Serandegwa breaks them down for us.
The ear is divided into 3 parts. You have the outer ear, the middle ear, and the inner ear. When you have a problem that is related to the inner ear, what that means is that the hair cells or the small nerves in the inner ear are not functioning appropriately. So depending to the extent that they are functioning, you can have a mild hearing loss, you can have a moderate, severe, or profound. It is the number of hair cells that in the ear that are functioning appropriately. So when you use a hearing aid, it usually benefits those people who have up to, let's say, moderately severe hearing loss. But when you have now severe hearing loss, that means a hearing aid which is just using acoustic signals which are relayed into the ear and finally to the brain. The hearing aid makes use of whatever is useful or functional in the inner ear. But the cochlear implant comes in to replace that whole pathway, in the sense that now the acoustic signal is not relayed to the ear, in a similar manner. It is now relayed through the external speech processor that we place, which connects to the internal component, which is the actual cochlear implant.
A cochlear implant is one of the most successful surgeries. Well, today we take part in one of the ongoing surgeries at Nairobi Hospital. The surgery is performed under general anesthesia. The procedure usually lasts about 2 hours. Only the internal component of the device will be placed during surgery. During the procedure, the surgeon makes a small incision behind the ear and then creates an opening in the mastoid bone to guide the electrode to the cochlea. The implant electrodes are placed inside the cochlea. Then the surgeon places an internal processor in a pocket between the muscle and bone behind the ear. The internal processor receives information from an external speech processor that will be worn outside the skin, which is connected later after surgery. The incisions are then closed and the patient is moved into the recovery area and watched closely as he or she recovers from anesthesia.
The procedure starts with first the diagnosis, which can be done even immediately after birth. We have tests that can do screen for hearing loss. Once it is confirmed, the earliest age at which we have done cochlear implants here is 1 year. If we can diagnose and confirm that a child can't hear by the age of 1 year, and this age is very important because naturally you have a window of developing speech, because if you can't hear, you can't develop speech. That window is up to 5 years of age. So ideally, we would want to do cochlear implantations or any intervention for hearing loss as early as possible so that this child can develop speech and catch up with peers.
After surgery and recovery, audiologists play an important role to ensure the device is operational.
So we had a 3-year-old child who will be fitted with a Concerto 2 with a Flex 28 electrode, and after switch on they'll be given a Sonnet 2 processor. So today my role in the theatre would be, the first thing is in package, we have to check whether the electrode is functioning, and then I hand it over to the surgeon. And once I hand over to the surgeon, I do a telemetry. So basically what telemetry is, we are looking at each electrode that, one, it has been inserted properly, and two, that it's all functioning. Then after that, I also do a quick check so that during the switch on, we're able to create what we call a map. So a map, we would call it as a program. It's the first program where we've switched on the patient, and that is the point where they start to hear. So over the course of the year, we'll be seeing the patient frequently, whereby we increase that map, then the patient is able to perceive sounds and eventually be able to have speech.
Though adults benefit from this kind of intervention for their deafness or hearing loss, doctors advise such interventions should be done when one is young.
The earlier you intervene, the more you give the child a chance of being able to get into an environment where they can acquire speech and language. So we would always recommend at least children who are below the age of 3 to come at least, if they have any delay in speech and language, let them be tested for hearing. A child who has not developed speech at that time should, in essence, actually have a hearing assessment. If they are found to have now severe to profound hearing loss, then that child becomes a candidate for cochlear implantation.
Cochlear implants don't restore normal hearing, but depending on the individual, they can help the wearer recognize words and better understand speech. After surgery, there's a required 2 to 4 week healing period before the device can be turned on. After confirmation that one's healing process has gone well, one will visit an audiologist to receive the external component of the implant, which will be activated. During subsequent visits to the audiologist, the cochlear implant settings will be adjusted to maximize one's hearing.
When we come to theatre, we make sure that we do testing of the implant while it is in situ. As soon as the surgeon implants it, we do what you call telemetry and ECAPs, and that is really just to make sure that the implant is working and at what level. And then after that, the patient, they close, and then the patient will come back to see us after 1 month, where we'll do now the actual activation. So the cochlear implant is in 2 parts. There's the internal component, which is now what we call the implant itself.
During switch on, what our goal is to start at a very low point, then gradually we keep on increasing as time goes, so that, because at the first point, that is when they are hearing for the first time, and we don't want to bombard them with too much sound. So we start slowly building it up until they're able to achieve the optimum hearing.
As part of the follow-up process, one will also meet with speech therapists who will help them develop listening and communication skills to support their hearing journey.
We have done the initial activation, which we also call switch on. That means now the child starts to hear. We work with the families to make sure that she, first of all, attends the therapy sessions. The ideal is at least 2 therapy sessions, 2 speech and language therapy sessions per week for an entire year, or at least a minimum of 1 session per week. But even then, because it is just 1 session per week, you know the child is in the home environment for the rest of the week. So the family is brought in, they are taught how to help the child in terms of learning speech and language, how to first of all appreciate the sounds that are around them, and also be able to just read with them at home, talk to them, and just to encourage them to be able to hear more. And then that's the only way they're going to develop speech and language.
Because the most important thing with a cochlear implant is that implantation may take a very short time. It can take even one and a half hours to 3 hours. But the most important aspect of it is the rehabilitation. Because once you get a cochlear implant, the child has to learn how to use it. So you can have a cochlear implant, but you don't develop speech, not because the implant is not working, because you didn't go for rehabilitation. So under the Cochlear Implant Group of Kenya, we have made it mandatory that you must prepay for the 1-year rehabilitation, because that means, because a lot of people raise funds, you know, if you just raise money for the implantation and then you go home, then you may not benefit. But when you have already paid for the first year rehabilitation, it means that you can raise further funds, maybe from the second year onwards, to continue with the rehabilitation.
Professor Macharia says so far those who have received cochlear implants have been able to develop speech and are now productive in society.
Of cochlear implantations, we have done now almost 150 implantations in this country, and most of them, the children are attending normal schools. We have also done on some adults, and they have gone back to their normal lives.
Although this procedure has a high success rate, the cost can be quite high.
The total cost is about 2.7 million. 1.8 million is the implant itself. Yes, about 900,000 covers the hospital fee, covers the surgical fee, theater fee, and it also includes 1 year of rehabilitation.
Mario Sana is an ENT surgeon from Italy and has been conducting cochlear implants at Nairobi Hospital through charity.
So our aim is to teach people, first of all, and then as a second, to have, for that we have founded a foundation, Mario Sana Foundation, with the members of my group. We are 10 people, for charity and for teaching.
Our goal is that we want to support in putting together a multidisciplinary team who will be working together to provide the technology of a cochlear implant to the patients in Africa and, of course, in this mission in Kenya.
The Cochlear Implant Group of Kenya has been collaborating with Nairobi Hospital in identifying those who need surgery by granting them another chance to develop one of the key components of sense.
As we know, hearing is one of the key or vital senses that we as humans possess. And there are lots of individuals who actually suffer, both emotionally, physically, and otherwise, because they cannot hear. And once the team of specialists identifies the people who are needy, then they are lumped into cohorts. And then these cohorts, surgery is arranged, as you saw today. We have a team of surgeons performing this, and also another team who are doing what we call learning from their superiors or the experts.
Cochlear implants are not a cure for deafness, but are a valuable tool in promoting hearing abilities. Belden, Waliaula KTN News.